Thanks for that, Hayley and Greg. As Hayley said, my name is Erica Noonan and I'm a Biosecurity Officer based in Biloela. Significant rainfall following a drought, as well as movement of cattle during restocking, can result in an increased risk of disease, parasite, and problem grass, weeds, incursions in your business. Today, I'm going to be talking about some of these biosecurity considerations. Botulism is a paralysing disease of animals, birds, and humans. This is caused by a nerve toxin, which is produced by the bacteria Clostridium botulinum. Botulism can be an issue where drought conditions have caused deficiencies of phosphorus and protein, which lead to bone chewing and eating of other unusual objects. The disease can result in rapid and significant losses. Cattle affected with botulism die of respiratory failure from paralysis of the breathing muscles. Cattle tend to have a stiff gait and saliva drools from their mouths. Cattle are often found sitting down, generally with their hind legs behind them in a frog leg position, much like the photo you see on the screen now. They are unable to rise and their breath becomes laboured. And some animals' tongues hang out and do not react when pulled, as you can see in that photo as well. There are vaccinations available for botulism. It is recommended to vaccinate all susceptible animals, and these animals may require an annual booster. Botulism can also be prevented through nutritional management. This may include blood testing and increased feeding of lick or mineral blocks. Leptospirosis occurs in cattle, sheep, and goats and is caused by bacteria Leptospira. This disease is zoonotic, meaning humans can also be infected. Leptospirosis is mainly spread through ingestion of or contamination of cuts and abrasions by urine of infected animals. People can prevent infection through good hygiene, avoiding situations or wearing gloves where contact with animal urine might occur, covering cuts and abrasions with waterproof dressings, and vaccinating livestock. Some of the clinical signs you may see in cattle with leptospirosis includes abortion or stillbirths, decline in quality and quantity of milk, bloody pork-coloured wine urine, rough dry coat, severe fever and death in young animals. The most common sign we see is a drop in calving numbers, and blood testing is required to confirm lepto. Clostridial diseases. Clostridial diseases are caused by anaerobic bacteria that is widespread within the environment. Clostridial diseases include tetanus, blackleg, Black's disease, malignant edema, pulpy kidney, and botulism. Animals are at risk of developing any of the clostridial diseases when recovering from drought, but particularly pulpy kidney. Pulpy kidney usually occurs when the amount of carbohydrates in the diet increases suddenly and substantially. It is most commonly seen where animals enter a feedlot, but can also occur when animals go from a high roughage diet to a high digestible forage diet, such as during the first flush of new green feed. There are two common vaccinations used. These are 5-in-1 and 7-in-1. 5-in-1 covers 5 clostridial diseases: pulpy kidney, Black's disease, tetanus, blackleg, and malignant edema. 7-in-1 covers the same diseases as 5-in-1 plus leptospirosis. Both of these injections require 2 injections 4 to 6 weeks apart and may also require an annual booster. It is important to refer to the label to ensure correct use of vaccines. Cattle tick. Cattle tick is an external parasite that can significantly reduce live weight gain and milk production. There are 4 main features which are used to identify cattle tick in comparison to other ticks in Queensland. Legs are pale cream and there is a wide space between the first pair and the snout. The body is oval to rectangular, the face is oval and wide at the front, and the snout is short and straight. Tick populations may be reduced during extended dry periods. The tick life cycle is dependent on heat and moisture. Consequently, as it rains, there is potential for a sudden increase in the tick population. Cattle tick can spend 18 to 35 days on an animal during the parasitic stage. During this time, the tick will develop from a larvae to a nymph and finally an adult. Adult females feed slowly for about a week, where they fill with blood and then detach. The fully engorged female tick drops onto the pasture and can lay up to 3,000 eggs annually. Depending on humidity and temperature, these eggs and larvae ticks can stay dormant in the environment for up to 9 months. This is known as the non-parasitic stage. When environmental conditions are appropriate, these larvae tick will commence infecting livestock. Tick fever, or red water, is a disease of cattle caused by blood parasites that are transmitted by cattle tick. These bloodborne parasites are Babesia bigemini, and Anaplasma magellani. In Queensland, on average, 5% of at-risk animals die during an outbreak. Pregnant animals may abort, and high fevers may reduce bull fertility for up to 1 breeding season. Some of the clinical signs you may see in cattle with tick fever includes weakness, depression, and loss of appetite. The tick fever vaccine is the most reliable and practical tool for long-term control of tick fever in cattle. It is ideal to vaccinate cattle at weaning, 3 to 9 months of age. However, animals can be vaccinated at any age. Immunity will develop 3 to 4 weeks after vaccination for both species of Babesia. However, immunity for Anaplasma will take up to 8 weeks after vaccination. This should be taken into consideration when restocking animals from the cattle tick-free zone. Biting insects, such as buffalo fly, midgie, mosquito, stable flies, and other biting insects, can increase in population following rainfall events. Cattle are adversely affected by these biting insects in 2 ways. Persistent biting causes distress and associated loss of production due to distress, and transmission of diseases by insects, such as 3-day sickness. There is a common range of management options, including pour-on treatments, insecticidal ear tags, oversprays, and back rubs. Bovine ephemeral fever, or more commonly known as 3-day sickness. Symptoms of 3-day sickness usually only last for a few days, but the disease can significantly affect the herd's production in the following ways. Temporary or permanent paralysis may occur as a result of damage to the spinal cord. Occasional deaths or prolonged recumbency may lead to Downer syndrome. Dramatic drop in milk production. Milk yield after recovery is often reduced by 15%. Lactating cows may dry up completely. Abortions can occur in heavily pregnant cows. And bulls may temporarily become infertile. Rainfall can cause growth or increased abundance of many toxic plants. The growth of these plants tends to occur more rapidly than pasture grasses after rain events. They can be harmful or in some cases fatal to livestock, so it is important to take care and minimise risks. If you notice a plant you are unfamiliar with, you should get it identified as soon as possible so action can be taken if needed. Early detection and management is crucial. A DAF extension or biosecurity officer can assist with toxic plant and weed identification. So my take-home message is just to recognise early signs of disease or plant toxicity, and try and prevent them if you can. If you do suspect anything, contact your local vet or your local biosecurity officer. I've also got up the top there the emergency animal disease hotline number for if you do suspect anything, such as foot and mouth or anything like that. Yeah.